we have Dean, and just about a month ago, he decided to come in and go through our laser stem cell signaling program for the bone-on-bone osteoarthritis of the left knee. He had a couple of arthroscopic surgical repairs. And if you could tell us your story about, let's start out with what Kaiser said about your knee and go from there.
Okay, they took a look at it because I had trouble. I had fluid on the knee, and I was struggling just to walk.
Where was it swollen before? The whole knee? Could you kind of point?
Knee, just the whole knee.
Yeah, I don't see much swelling today. It really went down, huh?
No, it's gone.
Yeah,
it's gone. In fact, ever since the treatment for when I saw you, it stopped.
Yeah.
It's amazing.
It drained right away. Yeah.
It just went away, and I just go, ever since I've been here, I've had no issues with my knee at all.
That's incredible.
And all the discomfort, the lack of mobility has been eliminated.
Now, did Kaiser say knee replacement might be an option? Or?
And they said that could be an option, and you could go that route if you wanted to go that route. And I go, I don't want to replace my knee. I don't want the knee replacement.
So 1 month later, how many % improvement would you report?
I'd say, I put down, I think 90%.
Wow.
At least.
So remember I told you don't expect more than 10% improvement a month? And here we are 1 month later. You're making 9 months worth of improvements. That's incredible.
Because now what I'm doing is I'm able to get around. I don't have any pain in the knee. Every night I go for a walk.
Yeah.
Every night.
And now you can start losing the weight because you can actually walk now.
Because now, that's exactly it. So now I'm trying to maintain the diet. And my wife tells me I have to lose the weight. And I said, I said, that's part of it. And I'm doing the light that
the home light.
I do it minimum 2 times a day.
Yeah.
I've done it 3 times on a few occasions.
That's good. Well, let's see your mobility. Let's see you able to get up better. Go ahead and walk to the door and back. Doesn't get stiff anymore. The first few steps that's great.
No.
Well, let's work up to 10,000 steps a day and stick to the stem cell diet, cut sugars, eat more healthy fats, and go from there.
Yes, because I've cut down, since I'm diabetic, I'm very restricted on
Yeah, you have to cut your sugar anyways, so the high-fat omega-3 stem cell diet's perfect for you, okay?
That's exactly it. Then I got, I got a supplement about 2.5 weeks ago.
Yeah.
I'm taking hyaluronic acid.
That's good. And that'll help lubricate the joint along with the cells.
And I noticed that the combination between what you did to me and the hyaluronic acid, I'm going, it's working.
There you go.
It's working. That's all I want.
Cushion it and lubricate it, right?
Yeah. And so I'm able to move around and do things I couldn't do previously.
All right. Well, let's continue the progress. Congratulations.
Thank you.